And let's see.
It's like a small group today.
Yeah, Penny's with us. Doesn't look like Allison will be.
I don't see a commissioner.
Let's see. No, not yet. I got a note that that Penny would be with us, Penny Githens.
Okay, good. We ready to roll? I guess we're live on social now. Hello, everyone.
Well, good afternoon, and I'm glad to hear we are all together for the most part, and may have still one or two more join us. Welcome to our weekly news conference up to this point with community leaders discussing developments in the COVID-19 battle. And this week, we're pleased to have Mayor John Hamilton from the city of Bloomington, Monroe County Health Department Administrator Penny Cottle, IU Health South Central Region President Brian Shockney, and I'm Kirk White, and I serve as an IU Assistant Vice President and co-chair of our COVID response unit at Bloomington. And today our goal is to answer any questions that you may have about the continuing developments in the COVID response in Bloomington and Monroe County and our region as well. So with that, let's open up with the comments from the mayor.
Thanks a lot. Can you hear me all right?
Good.
Good, great. Well, I'm glad to be with you. I'll give the quick reports on city data. We have no new cases this week and no positive cases, which we're pleased with. We're up to 522 of our employees have applied for the $100 benefit, which we're pleased with, pushing well over 50%, running towards 60%. I think it's good to remember progress. We're now into July. We've turned half the year over. It is good to remember we have made a lot of progress. Just one pretty significant statistic. It was about 7 months ago at its peak in the state that we had a death rate of over 100 people per day losing Hoosiers to COVID. The latest number is now 3 per day. That is an enormous and very powerful improvement, which we're very proud of course, driven dramatically by the vaccines, which have kept so many people safe and alive since they've been shared and used by all of us. We do want to continue caution. We continue to worry a bit, seeing some things around the country in particular. We know there are some resurgences happening in some states, some locations. We know that the Delta variant is here and Delta Plus, and reminding us that we are not out of the woods, and the vaccine is what is going to keep improving things for us. And I'll just make 2 final points this week about some updates. One, we did a kind of a SNAP city employee survey about vaccinations. We wanted to get some more information and learn some things. We got about 200 or so responses, and it was basically a few different questions. One was, why get vaccinated? We asked those, and those who were vaccinated, which was over 80% of them who responded, why did you get vaccinated? The number one response was concern for others. Over half said that was the main reason, the first reason they gave us for getting vaccinated, which was kind of encouraging, was concern for others. The second most was concern for self. And the third most frequent answer was to be free after the vaccination, to do more things. But it was driven mostly by those concerns for others and themselves. We also asked for those who were not vaccinated or did not report that they were vaccinated, why that was. The number one reason we got was too many unknowns about the vaccine, just too many uncertainties as the first reason. The second most popular was referencing particularly long-term effects of the vaccine. And third, even some said they viewed the vaccine as riskier than getting COVID in terms of risk to themselves. We asked those who, again, had not gotten vaccinated or didn't report that they had gotten vaccinated, what could convince you to get vaccinated? More than half said nothing. Nothing will convince me to get vaccinated, which is frustrating. But about a third almost said more information about safety of the vaccine, and another fifth or so said if I could get extra time to be sure if I got sick from the vaccine, that I could get extra time off. So our continuity of city government team, which has been active in this for many, many months now, is exploring all of that to keep working with our employees to see if we can move it forward. And then I'll close just with a thank you. The last point I'll make is this week saw the closing of the isolation and safe recovery shelter that had been operating since March 1 of 2020. So 16 months, this facility had seen about 300 individuals locally, including dozens of kids who were protected at this facility from the pandemic and the disease. They had no other good option where to go. It was especially popular and important over the winter when the surge was hitting. I just want to thank the group that made that happen. That included some city employees like Beverly Calendar Anderson, Mike Dekoff. It also included Penny Caudill, I know, very active in that, county officials and representatives, and of course, nonprofit partners, a number of them who focused on sheltering and supporting, and very dedicated staff members at that facility, which actually moved around a little bit, and the volunteers. But that closed its chapter this week, June 30th. Over 16 months, they really saved lives. They protected people, they protected families, they protected our community, and I just want to thank them for that service, and happy to take questions.
Well, thank you, Mayor Hamilton. That's a good development. And next, we'll hear from Monroe County Department of Health Administrator Penny Caudill for updates.
Yes, thank you, Mayor. I echo those sentiments. The shelter staff were fabulous, and our staff that handle our unhoused community all the time, every year, were just fabulous partners this past year and a half, and they always are. But as we've talked about before, this last year and a half has given us new and stronger relationships with everybody. So I echo that sentiment to all of them. Our advisory this week, we do remain in blue with, we're just holding steady, really, 28 cases per 100,000, our positivity rate at 2.33%. And while our numbers have not increased, and that's good per 100,000, they're just kind of staying where they are. We're not really seeing a lot of decrease. So we are still seeing virus circulating in the community. That's what that means. Today we added 12 new cases. So we know that virus is still circulating. And some of what we're seeing are essentially families risking one another's health versus getting vaccinated. When we see family units all being infected, that's kind of what we're seeing. So we want to encourage, again, that vaccination, and we are making progress, and I'm proud of the progress that we're making. We did fall short of that 60% mark that I was hoping to reach by July 1, but we are at 55.4%, I believe it is today, 55.4% fully vaccinated. So we continue to see those incremental changes and increases, and I'm happy about that. That is the positive of this, that we're not stopping that. We're not seeing that stop drastically. It is a slow and steady increase, but we would encourage you to continue to get your questions answered so that you have those answers and have that confidence in this vaccine. They really are very safe and effective vaccines. Where my concern is with that 45% who are eligible for vaccinations and unvaccinated, and those who are not yet eligible for vaccination. And so we have a large portion of our community who is susceptible to this infection. Those individuals are still shopping in our community. They're going out to eat. They're going to events. They're going on about business as usual. Some are taking the precautions that they need to be taking. They're wearing masks, they're distancing. Some are not. And that is where our risk to our community comes in. It's also why we continue to do outreach clinics like being at the fair. So Indiana Department of Health is at the fair today. They were there yesterday, so that people who were planning to go to the fair but happened to be unvaccinated had another opportunity to get vaccinated while they were enjoying that event that they were planning to do anyway. We continue other vaccine options. Of course, IU Simon Scott Assembly Hall is still open. Pfizer vaccine, so anyone 12 and over. And like other mass sites, it will be winding down. So go now while it's available. See Assembly Hall, enjoy that experience, but also enjoy the experience of knowing you are fully vaccinated and you have protection against this virus. Monday, July 5th, county offices will be closed. So the Morton Street community site, testing site will also be closed. No, our Miller Drive, our public health clinic will be closed. I'm going to defer to Kirk, but I bet the vaccine site will be closed as well on Monday. So just to kind of note that. But we do continue our Moderna Mondays, as we're calling them, at Miller Drive. So not July 5th, but on Mondays in general, you can make an appointment and get any of your vaccinations that you need. But Moderna is available on those Mondays. Staff were at Mother Hubbard's Cupboard yesterday and did a few vaccinations. We have scheduled to be at the Banneker Center, thank you, on July 23rd. And we have other clinics that we will be announcing as more details come and they get closer. I have a cautionary tale that I want to share with you. Illinois reported an outbreak at a youth camp this past week. 85 teens and staff with one young adult hospitalized. Some of the campers also attended a nearby conference where 11 more cases resulted. At least 70% of those at the camp were unvaccinated. The camp was not checking vaccination status, nor were they requiring masks indoors. This kind of thing can happen here. Let's not let it occur. And we can do that by following precautions and using vaccinations. We did announce last week during our press conference, and we submitted a news release this week, yesterday as well, that the testing site on Morton Street, 640 South Morton, will remain open through July. So that free testing site is still there. But just as mass vaccination sites are starting to wind down, so are mass testing sites. There's still lots of opportunities to be tested. It could be at your provider, kind of routine places that you go. It could be that you're going to one of the pharmacy style clinics. Even home testing is available. So there are many places, but I would say if you are unvaccinated, take precautions, arrange for testing as appropriate, and most of all, plan now for your vaccination, because then you don't need to worry about testing near as much. You know, this time last year, there was lots of routine testing. We didn't have vaccinations. People were just testing to be cautious. Well, now the cautious thing to do is to be vaccinated. So lots of opportunities. Take the time now to review the Indiana Department of Health dashboard for data, for vaccine sites, and for testing sites. That will keep it up to date. And be sure to complete your vaccination so you are fully vaccinated and part of the solution to ending this pandemic. Thank you.
Thank you, Penny. Good update. I know we were having a little bit of volume problem there, but I'm hoping everybody turned theirs up a little bit so we could hear all of your report. But I'm sure that if there are any questions, you'll be able to answer them if there was anything unclear there.
Okay.
Good update. I'm so glad that the state's helping us out at the fair. That's a great development. Encourage people to come on out to do the fair, and while they've got a few minutes between shows or visiting funnel cake booths, they can drop in and get vaccinated. Maybe that'd be a good thing. We'll you get a funnel cake as a reward. Probably still have to pay for it, but at least it tastes good. All right, next is our County Commissioner Lee Jones for an update from county government.
Thank you. I want to start out by saying how proud we are to be sponsoring the extension of the testing clinic for another month. And we would like to thank our co-sponsors, the city, IU, and IU Health, for helping to keep that going. It's certainly a beneficial thing for our community. Penny has reminded you that children between the ages of 2 and 11 should still be wearing masks. They cannot be vaccinated and they are vulnerable. So please, and if you're going to be around a child of those ages, then wearing a mask yourself is an extremely good idea, especially when indoors. And there's been a bit of confusion about what's going to happen with county meetings this month. It turns out that they will remain virtual through the end of July. That the governor's announcement yesterday does allow for that. So we will be continuing along those lines while continuing to prepare our meeting room, the Nat U Hill room, for the hybrid meetings that we will be holding in the future. And that's all I really have for right now. Thank you.
Thank you, Commissioner Jones. We appreciate the update. And now we'll turn to Brian Shockney, President of IU Health South Central Region.
Thank you. Thank you all for joining us today. And I appreciate the mayor's comments regarding the poll information and also the isolation recovery, that the people who have come together in our community to care for our most vulnerable, just another way that this community responds when necessary. As I shared last week, after a few weeks of lower numbers of COVID-19 inpatient volumes across the South Central region, we had an increase, and the story is the same. We continue to see increases in our numbers of patients across our facilities. And for the first time, we've remained in double digits. Today, the State Department of Health reported that 302 new COVID-19 cases, and this marks the first time cases in the daily report from the State Department of Health have topped 300 since June 12th. We are also seeing these sick patients in all three of our hospitals, Paoli, Bedford, and here in Bloomington, as part of this increase in numbers. The numbers in Monroe County between IU Health, Bloomington, and Monroe Hospital show a similar pattern. So while we continue to discuss the importance of vaccines, we know they are 90% effective or better in keeping this and all of us virus free. They're far more effective than many of the other vaccines that we have available to us and have had available to us in modern days. And as of June 21st, the CDC has reported only 4,115 breakthrough infections out of over 150 million people who have been fully vaccinated. The CDC has found that there's less than a 0.003% of 1% risk of hospitalization or dying as a result of breakthrough COVID infections. So this is an infection that happens afterwards, and that means 2 weeks after you have had your second shot or completed the vaccine. So more positively stated, over 99% of all hospitalizations that are occurring with those who are unvaccinated. That's the same here in the South Central region. It's the same in the state. It's the same at IU Health across the state and across the nation. Across the US, our Delta variant now accounts for approximately 20% of all of our recent COVID-19 cases, and it's reported to be 50% more transmissible than the dominant Alpha variant. So this poses a real threat to communities that have low vaccine rates. And as a risk of localized outbreaks and the community surges that are a real threat. The risk of another surge for communities with lower vaccine rates also poses an important reminder that as we move away from mask requirements, the intent of the removal of masks is only for those that have been fully vaccinated. Those are the ones that we want and can take off their masks. If you've not been fully vaccinated, I continue to encourage you to help yourself, your loved ones, and our communities and keeping us safe by making the right decision to wear a mask if you cannot be vaccinated or are not vaccinated, and most importantly, just get vaccinated. So as we head into the 4-H fair, festivals, vacation, and then eventually school season will be upon us in the next 60 days, we can expect increased spread of the virus if we don't get vaccinated and get ahead of this spread. None of us want to go back to mandatory mask mandates, isolation from our loved ones, restrictions on business volumes, and the anxiety that this virus creates. Your healthcare providers, we want you to know, we want you to move toward a new normal, a post-pandemic, where we can focus all of our efforts on improving the health of Hoosiers and providing care to those who need us most without exponential resources having to go to those who have COVID. This is your choice, and it is the right choice to get vaccinated. So I want to wish everyone a safe and happy 4th of July weekend. COVID has continued to take its toll on our healthcare heroes and our first responders that support the efforts to keep us safe. And we want to express our pride in this community and the hope for all to experience the freedom and support that we can continue to make this a great place to work, live, and play. And I'm happy to take questions at the end. Thank you.
Thank you, Brian. And I'll turn now to the IU update. The good news is, as I reported last week, of the over 1,200 tests that we conducted with our students, faculty, and staff last week, we had 0 positive test results. And that trend has continued this week. So no positive tests this week as well. And we hope to continue that trend. Remember this, we're doing a smaller number of tests right now because we're not requiring tests for those who have been vaccinated and submitted their documentation. So the testing pool has gotten a lot smaller here during the summer, particularly. We're continuing our planning for fall semester and looking forward to returning really to full operations, normal operations again. And just for a community planning perspective, I'd remind everybody that the residence halls will start their move-in process not very far away, August 15th. So less than a month and a half away. The campus will certainly be coming back to full life again with classes beginning on the 23rd of August. And finally, some more good news. I wanted to share the great news that this week we administered our 40,000th dose of COVID vaccine at Simon Scott Assembly Hall. This is Tara Porter, the 40,000th recipient, and she is a manager in our IU Dining Services Department, and she's standing there with some of our senior staff out at Assembly Hall who have been running that mass site so well over the past few months, and we thank them for their efforts as well. So with that, we're ready for any questions that people might have. We're happy to get those answered today. Well, let's see. Dave Askins is with us today from the Bloomington Beacon, and he asked, does the university have a percentage yet for faculty, students, and staff who are documented as vaccinated? Dave, I don't have a good number on that yet. We're still collecting a lot of that. Our big push really came through towards the end of this week because we asked people to get vaccinated really by July 1st so that they could get their second vaccine within 3 weeks and then be fully in effect in the 5 to 6 week period from today. And so we're still collecting those numbers. And so I don't have much yet. I do know they've reported that as each day has gone by, more and more have been added, but I don't have any final numbers yet. And so the next question then is for Mayor Hamilton. Did the survey have free response options, or was it just multiple choice? What's the fastest way to get the breakdown of raw numbers for the responses and the wording of the questions?
Thanks. That looks like a multiple choice question for me that I will try to answer, but no, I'm sorry, Dave, I will, I think it was a mixture. I know I'm pretty sure we had some free response, but there were options given, and I'm happy to check with probably our Director of Innovation or the Human Resource Director to see about how we can release the raw data. I'll try to have them contact you directly if that's okay. We'll plan on, I'll try to get that this afternoon. Anyway, I gave a summary of it, but happy to share that. And
Ethan Burks has asked a question from Ethan's with WFIU, WTIU radio and television. For Penny, with increased spread of the Delta variant nationwide, is the county considering reinstituting the mask mandate? And what kind of data would warrant that?
Yeah, at this time, we're not. I think that we would have to have pretty good evidence that we're seeing a lot of it here. We know that the Delta variant is in Indiana and it's circulating. So I'm sure that we have it in the county as well. With people who are fully vaccinated, you know, the requirement becomes very difficult because you have a portion of the people who are fully vaccinated and may not need to wear a face covering, and then you have half who aren't. And so being able to monitor that is where those mandates become very difficult. I think we will continue to watch the information and the data on that. And as we have with everything, science teaches us, we learn and we adapt and go from there. But the answer to that really is that we just need people to get vaccinated, and then we don't need that mask mandate.
Well, thank you, Penny. And Ethan has a question for the mayor. Is the city still testing for COVID in wastewater? And with IU students returning in the fall, is the city going to prioritize wastewater testing for COVID? Says he seems that could be an effective tool to identify outbreaks before they occur.
Yes, we are continuing to test, and I don't report that every week because it's not news, and so I don't try to. But we're doing weekly testing now in the wastewater stream at the two wastewater plants. So we had help, financial help, and we're part of the project earlier that put in machines and testers that were in more than those two locations. I think we had 6 or 8 around the city that were drawing weekly samples. That's not cheap to do and easy to do, but we did that, and they were, as you suggest there, it actually did seem that they could give an early indicator in the wastewater of the prevalence of COVID. I think it's actually the DNA components of the COVID virus that is detected. I don't think we've gotten the final scientific report from that pilot program, but those indications where it can be helpful. So we are continuing the weekly monitoring at the two wastewater stations so each gets 2/3 and 1/3 of the community, and have not seen any spikes. Indeed, they've all been at a very low number consistently, which is encouraging. We will continue to test through the fall, so far as I know, and I'll be happy to share that information. But I don't think we have the state and had helped with some that research project that was much more targeted, by multiple locations. But we will be continuing that weekly testing, and if there's anything extraordinary, I always ask Vic Kelson and the City of Bloomington Utilities to share that with me, and they don't because there's not anything. But I do want to thank them for continuing that monitoring.
Well, thank you, Mayor Hamilton. And Ethan, I'll also recap IU's testing plan for the fall. We will continue our mitigation testing for those who have been approved for exemptions. In other words, those who are not vaccinated in the IU students, faculty, and staff population will continue to have mandatory mitigation testing in the fall, at least once a week and perhaps twice a week. So it's our intent to be able to find any outbreak through mitigation testing, particularly for those who are unvaccinated, which are really will be our highest risk population for any kind of an outbreak. Secondly, we're going to do surveillance testing to be for those who are vaccinated, but but at a much lower rate. Nothing like what we had to do last year, because we don't expect much risk with those who are vaccinated. So their surveillance testing is more like a double check, but it'll be a very reduced rate for those folks. And finally, we'll still have voluntary testing. So if you're getting ready to take a trip to see family, you're not really sure, there's both voluntary symptomatic testing and asymptomatic testing that'll be available on the campus. So we'll continue to do that this fall, because we want to find those outbreaks as soon as we can. We'll continue to have quarantine and isolation facilities open this fall, and it's our intent to keep it as safe as we can that way. Thank you. Let's see. Any other?
Kirk, can I just add? I know you have one more. Can I just add? That's really significant that IU's doing that for our community. That most communities don't have that kind of background and surveillance testing going on with the half our population. That's a huge thing, and will be a real benefit. We appreciate that to help identify potential problems. Thank you for doing that.
Well, thank you. And Dave Askins from the Beacon has another question for the mayor. Are the City of Bloomington board and commission meetings scheduled for next week going to be in person, or still on electronic via Zoom, et cetera?
Yeah, thanks for asking. I have to confess, my most recent understanding has been we were planning to go to hybrid. That is a combination of in-person and electronic. Generally, we have a lot of boards and commission meetings happening, but I don't know for sure what the city council may have decided, which is beginning back July 21st, nor do I know for sure what each of our boards and commissions are doing. I know they're ready to and are converting to hybrid, but I'm just not sure which each one is doing. So it should all be available on the website, though. I'm sorry, I just don't know the answer for all of our boards and commissions.
Okay. Well, let's see. Any other questions? Any other remarks from our panel today? Things we haven't yet covered?
Happy July 4th.
Yeah, there's that. I'd remind everybody that we do have the county fair that continues on through Saturday, and as well, tomorrow is the reverse parade that the city is sponsoring along with university and others. It'll start at 10 o'clock at the north parking lots of Memorial Stadium, right off the bypass. You'd want to enter off the bypass, because the 17th and Dunn intersection is still under construction for the great improvements there for pedestrian and traffic flow. So you come in off the bypass. It starts at 10 and ends at 12 tomorrow, and we're glad to be able to team up with the city for that.
And you can walk or bike through that parade too if you want, or roll, however you want to move.
It'll be good tomorrow. The weather should be good to do that. So encourage everybody to take advantage in their weekend celebrations.
Yeah, the only final thing I would say is, this is a weekend we think about our patriotism. And so again, putting the we before me, and do the patriotic thing. And if you haven't been vaccinated, make a plan for it.
Absolutely. Well, without any further questions, I'll say that we're going to take this next week off from our normal news conference. We would have normally had one on July the 9th. We're going to take a break there and switch to a 2-week schedule here for July. So our next news conference for COVID will be July the 16th on that Friday at 1:15, just like we have been. And our good friend Andrew Krebs will get us all squared away on Zoom, and you'll get the notice about that. So with that, I wish everybody a good holiday weekend, and we'll see you in 2 weeks on July 16th, if not before. Thanks very much. Bye-bye.